fast
Yes,
as
he
you
will
can.
be here all haste. This show waits for no one. Except for me.
Unless the
Don't need
computer
tissues
breaks.
This morning or put a chair.
Oh, you gotta have a phone for that.
Yeah, I got it. Like I said, waits for no one. Except two-factor authentication. All right. Good morning. It is 10:02 a.m. on Friday, February 20th, 2026. Call this meeting of the Wichita County Commissioners Court to order. Item number 1, receive activities report from the Indigent Healthcare Office. I see we have our diligent public servants at the office here this morning. Good morning.
Good morning. Where's the little clicker?
Cody's right behind you. I bet he can
Okay.
do the thing, the clicker.
Uh-oh.
You have a clicker?
We're not gonna do a
Did
presentation
y'all give the
today, then.
presentation to IT?
Correct.
Yeah, they sent it.
Both.
From Morgan.
Mm-hmm, and I just sent it again.
She just sent
Half
it.
the facility, more than double the amount.
Why don't y'all go ahead and start, can you do the presentation without the slides?
Sure. Yeah, that's fine.
Did you see that?
A well-oiled machine this morning.
Thank you.
They're getting it uploaded.
Okay.
It's got
That's
you on
completely
there
fine.
too.
When?
Thursday.
It's also been y'all's backup information if y'all need to
Hadn't
look
got
at it
that
on
far.
there.
Okay. Well, I think the issue is we have it, they don't. And did you bring a separate copy for yourself?
I
Or do
do.
you have it? Okay. I think you can probably
Go ahead and,
proceed.
okay.
And commissioners, it's in the backup if you want to see
Okay.
the versions of the slides.
Will they like notify us whenever we can start?
Yep. Yeah,
Okay.
he's working.
Fantastic. All right, before we just start, I just want to formally introduce Danielle, who is now our new claims processor. Prior, all of our claims for indigent healthcare along with the jail medical was done in the auditor's office. So Danielle has actually started with us back in December. So Danielle, Danielle.
Good morning.
All right, guys, so today we are just gonna be going over what has been going on through our office for the past few years. So the first slide would have showed from 2023 to 2025, all of our average clientele for indigent healthcare that are active. So for 2023, on average, we had 80 active clients. For 2024, we had 89. For 2025, we had 94 active clients throughout the entire year. Currently, right now, we are sitting at 94 active clients. So again, they are able to get healthcare coverage, primary care, specialty care, vision, dental, pretty much the whole works for healthcare coverage across the board. Moving right along, just our average IA pending clients, so our initial applicants for Social Security. For 2023, we were sitting at 9. 2024, we were sitting at 8. For 2025, we were sitting at 9 again, and currently right now we are sitting at 6. One of those will actually be falling off because she was awarded her Social Security claim.
Is that a point in time count or that's the total sum for the year?
Total sum for the year.
Okay.
Are you gonna address the new step that we're taking to get reimbursables later, or, okay, I'll wait for that.
There-
then.
there's
Hold
a whole
on, hold
presentation.
on.
All right,
It would have been cute and pretty and everything, but it is what it is.
okay.
So our next one would have indicate what our expenditures have been for indigent healthcare, so account 642. So these reports coming now into the end are gonna be based off of February 6th when we got all of our verifications. Last ran,
He's working on it.
okay, do we want to wait? Cause these numbers are actually really great. I was really impressed.
We can hold off for a second.
Okay.
No, they're taking away all your thunder, aren't they?
Well, no, actually, the numbers are gonna be taken away, so it's very impressive for what the office has done for the past few years. And I really wanna highlight that for sure.
The numbers are the thunder.
Correct,
That's what I meant. That's the.
yeah.
Commissioner, do you want to tell us any jokes while we're?
No.
Let's talk about electricity.
You can talk about a bad drive back from College Station.
Let me tell you, there was a few wrecks yesterday on the way back from College Station. So that 4 hour and 45 minute drive took 8.5 hours.
4 hours of just sitting in traffic?
Yep.
Or maybe going
Well,
forward.
there was some
Yeah.
features on some small county roads that,
Oh, so
changed the
shut
environment.
down. It should shut down a couple places. Okay.
That's awful.
Let me tell you,
That's
when
terrible.
your red light on the truck that you've never driven before, the fuel light comes on, and you're stuck in traffic, and you don't have any idea how long it's gonna be, you're like, oh my goodness. And you gotta go to the bathroom. It's terrible. It's just terrible.
So it was an eventful trip, for sure then.
Not bad.
Yeah.
It was terrible.
Terrible.
But not as bad as it was for some people that were involved in the crash.
That's true.
Been on that part too, so I don't mind waiting anymore. Be thankful you're not in the crash.
Yay.
Okay.
Hey,
Okay, so our pretty and beginning, so just what we talked about for the average clientele. So currently, again, we're sitting at 94, even for 2026, for February. For I-8 pendant clients, our totals are sitting at 6, sorry. And currently, one of them will be falling off due to the fact that she will be receiving Social Security. So, this is what we're looking forward to. So these are our expenses for account 642 for 2025, ran as of February 6th. Our indication our totals have went down, so just from 2018 to 2025, the office have been able to do a 62% in reduction in cost for 2024 to 2025. That is a 9.5 reduction in cost. For what goes into this? So what makes up this number? So that's what's going to be in the next few slides, what brings in the total for those numbers. But what also helps us to lower those numbers is going to be multiple communications platforms that indicate that we can have our clients on, whether that's our insurance discovery or partnering with a mail-in pharmacy that's for prescriptions that's absolutely free. So just for a novo on our insurance discovery, we've ran 362 clients, and 126 of those have actually been found that they have a primary insurance. So then making indigent healthcare as secondary. So not only is this going for our clientele, but it's actually going for the sheriff's department as well. So we're trying to save budget across the board for medical on our end and medical on their end as well.
So a third of the folks who are getting applications for have primary insurance?
Majority of the time that we run it is because of the jail.
Oh, okay. So
majority of
those aren't applicants coming in off the street to do
Correct,
it?
so when
Okay.
we do get applicants off the street, we do run it, but only run it once. And then for the jail, since it is like a rotating door,
Yeah.
anytime that we have to either put somebody on the program, or even if we're denying them, we're still gonna end up paying it out. So we wanna make sure that everything is covered.
Okay.
it's been a really good, new tool that we've added. so
Correct,
Very
correct.
good.
Yeah, I don't think we would have actually known about it unless a outside agency from a sistering county actually would have said something about it,
That's,
so,
that's the power of networking.
correct.
Yep.
So what goes into making up those numbers? So from 2022 to 2025, yes, our office has had 6 clientele that have met their 30,000. So in that 30,000, what that's going to do is going to be for dental, vision, healthcare, and prescriptions. You do have to still think sistering counties, they're looking at anywhere from 12 to 50 people actually hitting that $30,000 marks. Yes, 6 is still a lot, and we still tried to get it as low as we can and make sure that we step in and have all resources and avenues available for that client so it's not getting to that 30,000. But again, I'd still like to highlight, sister counties are doing anywhere from 12 to 30 for that 30,000 cap out limit.
Historically, we were having clients max out just on prescriptions alone.
Correct. So another form that builds into our expense line, so amounts paid to vendors. What I would like to really hone in on is the most significant reduction is going to be for pharmaceutical. For pharmaceutical from 2018 to 2025, we're sitting at 92% reduced in cost. From 2024 to 2025, we're sitting at 36.25% reduction in cost. So again, we try to partner, try to network, we're trying to utilize all resources before hitting indigent healthcare line. Another key factor is even with how society is with economics, we've been able to reduce the cost from 2024 to 2025 in average cost per the hospital visits per client. So we're sitting at 34% in reduction.
Can you, the math that goes into that, is that total hospital costs divided by total number of patients, or is this actually based on the visits, and what's going into that number?
So the way that I utilized it was from 2020, so each year I would pull it. So from 23, 24, and 25, and then I would just do the average sum from there.
Okay.
So the numbers that it's getting it from is gonna be from our reports from Indigent Healthcare Solutions, running it per client the way that it is billed through our system.
Okay. The reason I ask that question is I'm trying to figure out, because we hit the cap with the hospital
Correct.
fairly quickly.
Correct.
Is that an artificially low number because we're just hitting that cap, or is it based on the actual visit dollars that are going in?
Probably both, because that cap goes to the jail and also Indigent Healthcare as well.
Okay, that's right, I keep forgetting that. Okay, thank you.
You're good, you're good. I will say for 2024, even though it is at 4,500, there was a lot more outside hospital visits like UNT, Houston, Dallas, everything like that.
Okay.
So, another expense that I would like to really highlight is our prescriptions. So back to our prescriptions, we were seeing at, for 2017 to 2025, a 93% reduction in cost.
That's incredible.
Yes, this is simplified, yes, that is incredible. Not only are we partnering, making sure that we utilize all resources in Wichita County, outside, whether that's mail-in pharmacies, providers, prescription assistance programs known as PAP programs, making sure to communicate with primary doctors like, hey, what can we do for this client? Making sure that we're not utilizing a high-end dollars prescription brand names, making sure that we utilize generics. Anything that we can do to help these clients, but still do it at a cost-effective form. So for 2024 to 2025, we've been able to reduce the cost for prescription by 35%. So again,
I'm not sure that there's much more savings to be found.
No, I don't know how you can do it.
you never know, we might still be looking for somewhere.
'Cause
Close the doors.
historically, we were paying 30,000 for one client.
Back then, back in 2017, y'all were paying about $1,500 per script. So
Yeah.
that's $3,000 for the 3 cap out scripts. We are now paying $500, still within standards, still within sistering counties, making sure that we are cohesive, parallel for everything across all platforms. So the average cost, kind of what I just hinted towards, was sitting at $1,400. We are now sitting at $508 for 3 scripts for a combination. Granted, not all clients hit prescription lines, not all clients need to be on prescriptions. They might just utilize it just to go to their visits. They might not take medication for anything. it is what it is at that point. So another form that helps us reduce everything is that we make sure that we have policies in play, whether that's ethics, making sure that they are going to their appointments, making sure they don't abuse the ER system, making sure that they're respectful across the board, because if anybody is to step out of line, they could potentially be kicked off the program. Our clients know that it is a privilege to be on indigent healthcare because we are utilizing taxpayer dollar and we are the payer of last resort. So what else helps us save money in the county? Well, partnerships, networking, communication. America's Best Eyeglasses is one of the best ones that we can mention for vouchers. That has saved our office $2,900 for the combination of 2024 to 2025. Each visit per client is $135, $134 and some change for the visits for glasses. So indigent healthcare does not cover glasses. We do cover the exams. So what else could we do to help these clients out to receive glasses since they are not able to afford glasses? America's Best stepped in and they're allotting us to have 10 vouchers per month. What that means is that will then cover the office visits. That will also give our clients the ability to do the exams and also get glasses, frames, and lenses absolutely free for them. So that's a 3-in-1 for them. But it also saves us $135 basically.
That's incredible. That's a tremendous service.
Oh,
Good.
okay. So not only does our office do indigent healthcare, but we also do the depositions of remains. So we were projected to hit at $30,000 this year. We did go a little bit over that by $9,345. But if you can see from 2024 to 2025, that is an 8.34% reduction in cost. We are currently working on one reimbursement to be fully brought back into the county funds.
That reimbursement's from federal government?
No, that reimbursement is going to be from the from the deceased who had funds in his account. So we are currently making sure that any funds are there, then that we recoup them. And if there is anything left after that, it is then going into an account started up by the auditor's office and our office as well.
And also, I've appreciated having the form now because when those come in, y'all are doing a good job
Correct.
of filling in all that detail of potential funds and potential sources that are available to recoup.
Yeah,
So,
Victoria is very great at that,
Yeah.
I would say.
That was a change recently made where the county judge has to sign off
Yeah.
on the ultimate cremation,
Mhm.
so.
Was there a change in the program, that 22 number being so big? What changed that?
So prior, we were not utilizing outside resources, meaning if they could be donated to science, if they could go through all cremations, and then I think also making sure that contracts were up to date.
well, and if I remember correctly, I believe we went out for bid and got multiple bids that drastically brought down that
Yeah,
price.
the price was like $699,
Yeah.
and then it went down like $400
Yeah,
or something.
between
That
23
number is reimbursements, but that would also reflect more cost, I would assume. That's part of it. It's just, anytime there's
Lower
a,
bids.
what's that?
Lower bids.
Right.
That's the cost amount. The reimbursement's still at the bottom. It's just an
Correct,
extra
plus
piece of
reimbursements were
information.
not
Oh, okay, I
done.
got you. That's what, yeah. It's always interesting to me when you see large variations is to try to pin it to something.
Yes, sir.
Sometimes it helps you see what's going on, but,
Yes, sir. And I will say reimbursements were not done until 2024.
okay.
Prior to that, we were not the ones handling it. It was our prior predecessor, so.
But yeah, I think the biggest change was there's a combination of things, but was going out for bids and getting significantly cheaper rates.
So what has helped to lower our costs? Well, doing outreach, just speaking with people, communication, networking, also finding out how to do reimbursements for the county. As of this month, we've actually been able to reach out to a sister in county, I think it was Ellis County, and talk to see how we can get reimbursement from Medicaid or whether it's for the providers. At the end of this month, we'll actually get that ball rolling and hopefully we'll see some more reimbursements coming in the way. So our expense line will be going hopefully down even more than what is projected.
That was a big goal for Danielle to achieve early on. Well done.
So this is just a part 2 of what events we have done. Currently, we are projected to see anywhere from 60 to 70 outreach events for this year alone. Our upcoming events, we have listed, since I've turned this in, we've also added on there Haircuts for Homeless, March 16th. Yesterday, we just got done speaking with a mutual partner for mental health officers in the county. Hopefully that program will then get to start up. And then in March, we'll be starting back with the mobile food pantry, just getting word out there, getting resources out there, because if we can't help them, at least there's a resource packet out there that can help them. So, this is just a recap from everything from 24 to current, so just to kind of see. And then also, if you would like to keep up with us, you can follow us on Facebook for everything. If there's any questionnaires, or if there's wondering what indigent healthcare is doing, we do post pretty, hopefully regularly now, but we'll kind of keep everybody in the loop for there.
Okay.
Any questions, comments, concerns?
As always, fantastic job.
Thank you.
That's quite, it always surprises me every time I see it. It's quite a curve of expenses. Thank y'all very much. Good
Thank you.
report.
Thank you.
That does go to show you that there is lots of avenues out there.
Correct.
And a lot of times, in a lot of county government, same way in the jail, same way with our lawyers, you know, they file for a court-appointed attorney, and we don't do a lot of research into researching if they really need a court-appointed attorney, because it takes so much time to do it. I do appreciate what you are
Thank you.
doing. It makes a big difference.
Thank you.
Yep.
More government agencies probably need to do that.
Thank you.
And
I appreciate
providing
that.
a good service, which is always.
Yeah, the
important.
service is improved.
Yeah.
That's the key thing. We're providing a much better service.
Better service at a lower
And
cost.
lower cost.
Benefits the citizens and
Yeah.
the taxpayers of this county.
The people that actually need the services are getting it.
Yep.
And the people that really aren't eligible for it are no longer getting it, which is part of that huge number drop off, so.
Correct. Again, we just try to do our due diligence to make sure that people are following policies, ethics, procedures, everything across the board, and then also educating ourselves in regards to what's out there. What could also help everybody? Vouchers, reimbursements. If money's going out, money can come back in.
Yeah.
Simple as that.
Okay.
Thank you, ladies.
Great job. Thank y'all.
Thank you.
All right.
Judge, I don't have to do my precinct presentation right behind that. do
No,
I?
unfortunately, I was gonna say, so, Sheriff, we look forward to the same cost curve on
My thunder's not gonna be there.
review,
The old hard
Review and-
act to follow.
yeah, review and discuss jail maintenance projects and work orders. Go ahead, sir.
Well, I tried to open the one that came in today, I couldn't open the email in here, but last week they had 68 work orders, but the main thing is they're working on the roof, so.
Timely for those spring rains that are coming,
Exactly.
so that's
Get
good.
it fixed. So I don't have to update for this week, but I know the week before last I had 68, work orders, and just fixing things as they break. We're gonna replace a portion of dryers, so they're coming out PCI, they're starting to wear out.
Well, I'm having, people tell me that they're appreciating rural patrols. You guys are visible.
Yes, sir.
That's important to folks out in the country, and they notice.
Yeah.
They do notice.
Y'all are getting a little early practice on wildfire season this
Yeah.
week.
Yes, it did. Hope it rains soon.
So
They're not back here. We've been
So-
waiting.
we'll get a pretty good bill on our roof, but I do wanna mention at our conference this week, there was a presentation of a new jail facility that was built. It's supposed to be super efficient and very cost effective. In comparison, their facility's 336 beds, our facility's 719. Their total cost for construction, 166 million. Our total cost for construction, after we added some stuff back in at the end, was 72 million. So,
Double the space, half the price.
double space, half the price, in a 4-year difference in time. So,
I couldn't do that.
yeah. So having a little $20,000 roof repair compared to double the price.
How long is the repair expected to take? They give you a ballpark?
I'm gonna guess a week or two easily.
You haven't shut down any pods or anything while they do it? Okay.
And,
Seeing any changes in the out-of-county numbers?
no, still staying around 40, 43, 45. No real big uptake.
And Collin County's not expected to come back anytime
I
soon?
don't think so.
Okay. All right. Commissioners, any questions on jail maintenance projects or work orders? All right. Item number 3, receive status report on salaries and overtime. Wilmer sent that out yesterday at 8:05 a.m. That's early, man.
So we do have 3 openings in the jail, but I have 7 in jail school. We have 4 that were hired several weeks ago. They're still in training, so they don't count on the floor. So that right there puts us at 14 short on the floor. We got 2 OJI and 2 FMLA. So it was 18 short on the floor. So we did have some overtime, plus the 581 hours of sick or vacation that was taken. So our overtime was up from 2 weeks ago.
We went from 18 to 0 to 18 pretty quick.
Pretty quick when you start figuring all the other stuff in there. However, we do have 8 job offers to make. I know we talked about filling the 5 409 positions. And, so we filled the 3 openings and to give us extras.
So one of the cautionary tales we heard at the class this week was data centers use a lot of security workers and they pay really well. So it's gonna be something that we're gonna have to address moving forward.
What the sheriff just heard was during a departmental budget meeting. So I need to ask for more.
Exactly.
But
what
I
heard.
mean, it was
We're gonna
it
be a
was
long summer,
presented to
really.
us that that's a challenge that we all have to face,
We're gonna
so.
have to think about it, and then some of the changes coming up maybe.
It's gonna be countywide and citywide. I mean, these data centers are gonna pull people from everywhere. It is gonna be a struggle for our city and our county to keep employees in any positions when they can look at making that kind of money somewhere else. So it's not just
Yeah.
it's gonna be but it all still falls back to, people like to do this kind of work, or they like this environment, or
Yeah.
they like these people to work with, so it all plays a
Well, I
factor.
will say my training guys, the 4 or 5, I have 2 full-time training, recruiter, Melvin, community services, and sergeant over that. In 2 years, they've done 195 applications.
Well, you're doing a much better job right now of retaining,
Yeah,
and
our retention's a
so
whole lot better
that's
now.
huge.
It's, there's going to be growing pains with any sort of big investment like that. I think everyone just needs to be aware of that. But it's growing pains because you're growing.
But there's tax money on the back of that too, so.
Well, and to the point that Commissioner Buchanan, I think, was sort of getting at is that I think we're all going to have to be cognizant of work environment's probably going to mean, because you're never going to be able to compete.
Yeah.
You can never
Salary
compete
wise.
with the private sector. So
Never.
it's just gonna be a struggle through the whole city. And a lot of people, there's people that are really looking forward to all this, and there's
Mhm.
people that hate the idea of it. It's gonna happen.
Yeah.
And we're gonna grow, but it's gonna be tough to get through it. It's not gonna be easy.
Whether it happens here or somewhere else, they're gonna build, or
Yeah.
have
Yeah.
to build here.
And
So,
their building in Archer County would still lose the same,
Yeah.
have the potential to lose the
Same
same.
people,
So,
absolutely.
just, retention is all the more important now. I guess that was the point I was
Yeah,
trying to
Yeah.
make,
and
is
we've,
that,
I feel like we've worked well together the last few years on that, so.
Do you, how many do you have out right now, the FMLA or?
2 FMLA and 2 OJI. And I think one maybe because of the birth of the child, so, that's FMLA.
8 job offers for 3 openings, and I guess you're hoping the
The-
court approves
Still
the 5.
Or approves of 5.
Yeah, okay.
Do I need to bring that to,
I've got it slated for the agenda, not this coming Tuesday, but the following
Okay.
one.
good deal. It's been a long time since we put anybody in 409.
Hadn't happened since I've been here, so.
it's a good problem to have.
It
It's a good
is.
problem to have.
Morgan, will you go ahead and note that? Thank you. Okay.
first thing I look at, is the overtime, then look at why it spiked, and that was why.
And you may have already answered that in what you were saying. The spike in 560.
Now, 560, we had 2 critical incidents,
Okay.
so a lot of overtime. So, that explains those hours.
Okay. I know it's a small data set and it's early, but it's the first time I can remember year-end projections for SO as a whole being in the black and not in the red. Unless I'm reading that wrong. I don't think I am.
It's pretty early in the year to be.
Like I said, it's early.
I mean,
We're doing our best.
Okay. Commissioners, do you have questions, comments on salary? Salaries and overtime?
No.
Okay. Let's move on. Item number 4, review and discuss regular bills. Thanks, sir. Matt, did you or Margaret send this one?
Margaret, why not stay?
No, it's okay. Energy wore me out.
Yesterday at 11:40. Wilmer's making you look bad, Margaret.
Well, that's what he just giggled at me, and I said, well, if I didn't have to wait on the whole office to get it done, I could have beat it. But, you know, they're just conspiring. against
Friendly
me.
competition.
Yeah.
Well, you have more tabs to do.
That's right.
Yeah. And someone always goes, oh, did you run it yet? I have one more thing.
It's usually Gomer.
It is.
That's funny.
Would it speed things up if you just put all the expenses over on precinct 2? Would that make it quicker? We're trying to help you here.
Between precinct 2 and precinct 3,
Yeah.
they got the most money.
Oh, yeah, and there's a reason.
That is true, there is a reason.
Yeah, it's amazing, and you've all.
Well, I'd have just as much, but I spent my million fixing a road.
Yeah,
Well, I'm
last
trying to
Yeah.
get there,
He's
so
trying
I'm
to
gonna get there right now.
It is just amazing what all this stuff costs now. I mean, it's really sticker shock, and it's been that way for a while. But just the least little thing will just take your breath away. It's just,
One thing to note is that Core Health was on this list, and it paid also last week, and that was because they forgot to send us our January
That's right.
invoice.
We were hoping they just continue to keep forgetting.
Right.
If they
Oh, I
forget,
know.
we can't just pass it.
No, I don't know, it's my fault. I emailed her and asked her where it was at, and she was like, oh, I was holding that till I got the new contract, and I forgot to send it.
No, we would have paid it at some point. Better
They
to.
would've eventually thought about
Yeah.
it, been like, hey,
Is that just a 1-year extension or?
For Core Health?
For Core
Yeah.
Health,
It's their
we're-
meetings.
That, like we talked about last year, I think we'll be doing the full-on RFP this year. And won't that be fun?
I just look at a fuel bill here, even though full well realizing that just, 2 years ago, it would've been twice that. But still, it just takes your breath away like, good grief, it's.
So So, since you mentioned fuel bill, I'm still buying all my fuel from the city. Are we still going to get P cards to
Yes.
move
so
off of that?
The court approved that policy week before last.
Yeah.
And the issue really isn't just issuing the P cards, it is, we're meeting, Margaret, Mike, myself and Todd are gonna meet Monday and figure out how to merge those accounts, and then
Mhm.
also, that way we can submit it to the court and say, we need to merge the following accounts, come up with this amount, and then get with the bank on them transferring it over.
Okay,
That way we have everything in court's approval, and
so we're not ready to
Take action.
roll it out completely to
Right.
the precinct.
we don't wanna do one big account and then have, 150 cards and
Okay.
try to reconcile 150 cards of transactions each month.
Tell the
We would
truth,
have-
I don't wanna.
Yeah.
Margaret doesn't have to do it, so,
And the reason that's important is because of new legislation exempts us from taxes.
right, yeah, 20 cents.
So we've changed the line, so all the fuel's going, it's not going to repair maintenance of vehicles anymore. It's going in a separate line, so it'll be easy for Matt to pull and get that reimbursement from you
Mhm.
guys. And then right now, just continuing to go to city fleet.
Yeah.
until we get the contract.
Yeah, I'm fine right now. I just wondered when that was gonna happen.
We are
you able
hoping
to click
for
on
third, well, not
the blue
third,
stuff? No, you're not.
yeah, to have that on the
No.
agenda.
Okay, thank you.
I'm noticing I can't click in the PDF on anything that goes directly to Munis. Is that a me issue, or is that way on y'all's as well?
We deleted your access.
Mine doesn't have it.
Fair enough. Yeah, Mickey doesn't have it either.
Just a joke.
So it's just the commissioner's court.
Is that so we're being locked out of something? Is that what it
Hey,
is?
Oh, Lord.
Oh, goodness.
Listen, I don't need any more sheriff deputies up in the office. We're good.
I just wanna make sure if there's a disconnect on the plug-in, I need to know that so I can work to get it
I do know
fixed.
that they're working on the VPN, but they weren't supposed to do anything, and they have not responded back to me, so, let me see. Yeah, mine's not clicking either,
Okay, we'll figure that out.
but I bet that that's probably is, they're testing that connection for the VPN.
Okay. Then I hope you know all the answers to questions off the top of your head.
Shoot.
I don't have any yet.
All right, you did like you had when you took a gas. And Mickey's dying over there laughing, so he's got something.
No, I'd appreciate your office's help in getting my electrical order finally done.
Of course, anytime.
Now, if you keep the same rate or not, it's a different story.
Right.
As
Listen,
many
we've been
people as I
around-
talked to beforehand that said we could, somebody's gonna have to hear a lot of griping if they say no.
Mickey might send out the next email, and it may not be as nice as mine was.
She was like, I can't send that out. I said, I want you to be firm.
I said, I don't think I'm gonna use those words, cause I need my job.
And yeah,
Does our software block stuff like that?
That's a Cody question.
Yeah,
Yeah, can we
Good
get
job.
the email to not take curse words?
you can't say that. Yeah.
Matt, have we started to see more requests come through for Child Welfare Board? Not yet? Okay. I think I'm going to their next meeting in a couple of weeks, and may just visit with them about that again.
Yeah, and I know that we had talked about discussing that further in budget session for them potentially just doing a, support payment rather.
Yeah. Okay.
Wilmer, can you go back into time clock and make sure we take Cheeseman out of my queue? I'm still getting time off requests.
Yes, sir.
Jail.
All right, everyone had a chance to look through any other questions? All right, let's move on to item 5, which is receive update on courthouse renovations and county courthouse annexes. Commissioners, who wants to go first?
Mark.
have much to report other than, I think we're looking at maybe having to do an asbestos report update for the JJAP building. I don't have all the details yet, so.
No news is good news.
Commissioner Buchanan?
Burke is, the disassembly is coming along quite well. The inside is completely gone. There's only a shell of a building. The added on rubber roof that we got in probably 2019, 2020, when they overlaid all the metal roofs, that, as I griped about back then, it really showed when we took this roof off what it did to our structure that's there. They take them metal roofs and they have to put screws all over it to hold down that foam, to put that rubber on there. I hope we never do that again as a court. I hope we never approve that for our county buildings.
You sure hurt your base, didn't you?
Yeah, but, I mean, this building's coming down, but it just really shows how bad, in my opinion, how bad a product that is to put on a metal roof. But that is all off the Burke building now, and we're taking on all the trim. As long as the wind's holding off today, we're removing roof sheets today, so it's coming along pretty good. The electrical will finally be off today. I do need IT's assistance, if they haven't called you yet this morning. We still have some data cables going from the front building to the back building. I don't know if that's something we can just cut off. I would really like to have your blessing before we do that.
Always a good
I
idea.
don't have a clue what they are,
You need some bolt cutters.
but you know, they're woven cables up there, and I've never seen anything like it in my life. But, the job seems to be going pretty good.
Mickey, how much, concrete demolition will you have? Yeah,
There'll be altogether, probably about 3,000 square foot of concrete.
we might need some riprap on our lake.
Have I got a deal for you?
Well,
If the county put it in, it probably doesn't have any steel in it, so.
well, let's don't haul it off till we see, cause we're gonna need some on that lake project.
Well, that's great.
Yeah, that'd work good.
I'm willing to let you come over there and take it up for it.
We might wind up just moving it once would be my goal, otherwise that stuff's hard to handle.
It'll be pretty quick, so.
Yeah, okay, well, we'll go look and talk about that, see if we can.
Precinct 2 can provide you a delivery and a pickup.
Deliveries.
For rich budget transfer.
Yes.
I didn't wanna
Oh, yeah,
ask,
we
but that's
can.
really what I had on my mind, but.
Yeah, for budget transfers, we can even deliver.
See how they treat me. They just won't let me have a deal, that's all there is to it. But seriously, I was just talking with Sam this morning, we thought that might be a option, but we're gonna need some, and, to get that project where we need it, that'd work.
And I have decided, I think I'm gonna leave the parking lot until we get the building back up, so we have a base
Yeah.
to work on, a parking lot to
Oh,
work
yeah,
on.
make it much better.
And then eventually that parking lot will come out too.
Yeah, okay, good, that's good. I love it when a plan comes together.
All right. I think that concludes everything. Any questions on courthouse renovations or
Oh,
annexes?
just one comment, Judge, and I think you heard it too. Tommy told us this morning, they're very happy with the way things are working in the Owl Park building under this is our first election, under with the new construction. He said the parking's helped tremendously. The flow in there is good, so far good reports on that. You like it when that happens, and, I think they've had some, fairly brisk voting, so that's a good thing. Said that parking lot was really full, I think yesterday, so that's good. But
There's
it's
a lot
working.
more room to put people in that hallway, and they can actually sit down and
Yeah.
gather in the queue.
One other quick thing, the Burt voting location has not changed from what it's ever been.
Yeah.
It's a great place to go vote.
It was, it is, and will be.
Yeah.
It's still
Until we have a
there.
better place.
Okay. Well, then with that, it is 10:46 and court is adjourned.